My child prefers to stay alone. He does not mingle with any of the children in the apartment. He does not even play with his cousins or his brothers and sisters. He does not even look at me when I talk to him. Does that sound familiar? Does that ring a bell? Hey guys, Dr. Naeem Sadiq, neurologist, neuropsychiatrist, founder of Plexus Neuron Stem Cell Research Center, bringing the continuation of the series which I had started last week. As I had promised, the previous one was the signs of autism age-wise. Today, I'm going to bring to you the red flags. What are the signs when you see in your child? It should alert you and warn you so that you take your child immediately to a specialist, get a thorough assessment done of the child, and start treatment as soon as possible. The first thing which is noticed, the most common when most of the children suffering from autism, is the child does not respond to the name. Now, if you know the normal development, if you have other children who are normal, whose development has been completely normal, by the age of 12 months, during the first birthday, the child should respond to his or her name. If you remember my previous episode, I had brought this to your attention as to what are the things which the child should do during his first birthday. So 12 months of age, 1 year of age, and the child is not responding to the name, yes, that is a red flag. Normally, children point to objects in which they are interested. For instance, an aeroplane, a bike, or a toy, or a milk bottle, or a packet of chips, whatever, things which they like or in which they are interested, they point to those things. If your child is not pointing out to these objects, the red flag is on. The child is probably suffering from autism or autism spectrum disorder. Children usually play pretend games. You must have played when you were kids. You must be remembering those days, or you must have seen other children play, like for instance, trying to feed a doll, or trying to dress a doll, or these pretend games as if they are living objects. Now, children who have autism or who have started developing features of autism lack this. They do not have pretend play at all. And most important is avoiding eye contact. Normally, a child should look into your eyes when you talk to the child. But in autism, children who are suffering, they avoid completely. They'll be looking somewhere else as if you're talking to the wall, or they don't mean anything. You feel when you're talking to a child who's suffering from autism, okay, whom am I talking to? There is no response. He does not even look into your eyes. Making eye contact is one of the very, very important signs which is found in most of the children in autism and autism spectrum disorder. And these children prefer to be alone. They do not want to play with any other children. They can stay for hours together in their own room, in a corner, having their own imaginary play, or sometimes they would sit in front of the mirror looking and pretending they're doing something and mumbling to themselves. So preference to be alone is yet another red flag which you all should be warned about. Emotions. A child understands the parents' emotions. Like for instance, when the father or the mother is happy, they come towards the child responds, the child also smiles or giggles or even laughs. When the parent is angry or makes frowns at the child feels scared. He might even start crying or run away from there. When the parent is worried or sad, the child understands the feeling. But children suffering from autism are unable to understand whether you are happy, you are sad, or you are angry. For him, you're just an object. He does not understand any of these emotions. Not only does he not understand your emotions and feelings, He himself is unable to express his emotions and feelings. He might be very happy, but he does not know how to express his happiness. He might be upset, he might be angry, he might be sad. But other children, they cry, they run away, they throw tantrum, they might, throw things around, whatever. And when they're happy, they might come hug you, kiss you, show the signs of happiness. But a child who's suffering from autistic disorder will not be able to either understand your emotions or express his emotions freely. If he's doing this, yes, that's a red flag for you. And these children may have the speech problem is yet another very, very common problem. In fact, most of the parents come to know that the child is suffering from autism or child is suffering from some developmental problem when the child does not speak, or the child who was hitherto speaking loses his ability to speak. So these children will either not speak at all or will be speaking in one-word phrases: food, water, milk. They will never be able to form a sentence and say, I'm hungry, I want to eat food, I want to drink milk. No, they might just say one word, or they may not say anything at all. The other red flag is where they have what we call as the echolalia, where the child will echo whatever you speak. Like for instance, you ask the child, what is your name? The child will say, what is your name? Do you want to have a chocolate? The child will respond, do you want to have a chocolate? Yes, this is yet another red flag. Or at times, the child will give totally unrelated answer. Your question would be something and the response would be entirely different, totally unconnected to the question which you had asked. Most of the children with autism have a fixed routine, a set pattern, and that should be followed at any cost. Now, if the parent or the sib disturbs that routine, they have had it. The child cannot take any even the most minor upsets in his routine, and they will have obsessive interests. They might be fascinated with certain things, and those are their prized possessions. Like it could be pencils, it could be a particular color of rubber bands, it could be a particular color of shoelace or whatever. They possess them. They're obsessed by these things. And finally, one of the most common feature which is found in most of the children suffering from autism and autism spectrum disorder is what we technically call as stereotypies, where there are certain fixed pattern which the children do for no reason. It could be either flapping their hands and jumping up and down. It could be clapping, or commonly found is rocking, rocking to and fro. Moving their feet, moving their fingers, moving their toes, wriggling all the time. These are known as stereotypies, and yes, this is yet another red flag which should warn you that my child is not normal, child is not growing normally, he might be having features of autism. So guys, in today's episode, I have tried to cover some of the red flags which I want you to be aware of. I want you to be warned about. I want you to know that these are not normal things which will disappear as the child grows. No, these are going to cause hindrance to your child's development, hindrance to you, hindrance to the relationship you will have with your child as the child grows. So if any of these are found in your child, my suggestion to you, my advice to you, my recommendation to you is that a rush to the nearest specialist, the person who is specialized in evaluating, assessing and treating children with autism and autism spectrum disorder. Get assessed, get evaluated, and if found that the child has autism, get him treated as soon as possible. And for the treatments which we have at Plexus, you could visit our website which will give you the details of different kinds of programs which I have been doing for the last so many years for children suffering from autism. And so many of these children are now close to normalcy. There are a lot of children who are attending normal schools. So guys, if you've liked this video, this episode, please click the like button and do subscribe to our channel, because I'm going to come next week with yet another episode on the series of autism. And next week I'm going to talk to you about the social skills in autism. And yes, press the notification, the bell which is there on your screen, and keep following us on all our social media platforms. Till then, take care.